It's now easier to detect lung cancer in longtime and former smokers, thanks to a new screening program at Intermountain Medical Center. For more, we're joined by Dr. Denitza Blagev with Intermountain Medical Center. Thanks for being here.
Thanks for having me.
So tell us about this screening process, this screening program, and how is it new?
So lung cancer is detected by doing a CT scan of the chest, which is a kind of three-dimensional x-rays. And up until a few years ago, there were no studies showing that if you do these extensive tests on people, you actually benefit them in any real way. So it was in 2011 that there was a big randomized trial that looked at people that were screened with an annual CT scan of the chest for people that were high risk, and actually found that their lung cancer mortality was reduced and the overall rate of death from all causes was reduced. And one of the questions that remained outstanding as a result of that trial is, can we really translate these findings out into the real world, where it's more real-world scenarios and different people can be enrolled. And so at Intermountain, we started the lung cancer screening program where we can screen people who are at high risk for lung cancer and detect cancers earlier so that they can be treated earlier.
And it sounds like you're detecting them before they maybe have symptoms or start having those complications.
Exactly, and that's really the idea with these screening tests. If somebody has symptoms, they really need to be evaluated by their doctor and see what appropriate therapies or diagnostic tests they need. This program is really for people that have no symptoms, are at high risk of lung cancer, and then they go in and have a CT scan to look for lung cancers that are small enough that you can treat them by surgery or radiation and take them out before they grow and spread and become a problem. Lung cancer, unfortunately, has one of the worst mortalities. It's a cancer that a lot of people die from that we don't have great therapy for
treating it. So we're talking about smokers and former smokers, because even if you stopped 20 years ago, you still have those lingering effects. But lung cancer doesn't discriminate on non-smokers either.
Right. So the program and the study was specifically in the highest risk population, and those are the people that have smoked 30 pack years or more, and are either currently smoking or have quit within the last 15 years.
Oh, wow.
And that is the population that's at highest risk. But you're absolutely right, about 10 to 15% of lung cancer is diagnosed in non-smokers. And so there's a variety of other risk factors such as radon exposure or genetics or having a history of lung disease or lung scarring, and in Utah especially radon and occupational exposures are other big factors.
Well, it's good news to hear we have screenings that can detect it early. We know early detection is key for all cancers. We'll put the details on our website at goodforutah.com so you can learn more about the program and what's offered at Intermountain Medical Center. Dr. Blagev, thanks for joining us.